non-surgical jaw augmentation is one of my favorites. Everybody, men and women hate the jowls along the jawline. These hanging pieces of flesh here that disturb everybody, and the minute they turn in the mirror from one side to the next, what they see is the jaw, is the portion of the jaw hanging down. Now, how do we get to that particular stage? How does one age to that particular stage? Well, again, it's loss of volume. And as you lose volume in the chin area, when the chin recedes, as the bone recedes and the muscle and the fat pad in the chin recede, it goes backwards, pushing this down. You have loss of fat in the cheek area, and as that loses fat, the skin begins to droop. Everything heads downward. And where does it head most? It heads to that jawline. And one of the hallmarks of the aging face are these jowls along the jawline, these hanging pieces of flesh that people absolutely are the mark that aging is taking place in the face. So how do we address this? It's very, very simple nowadays with non-surgical rejuvenation using volumizing fillers. What happens is, if the chin needs to be augmented because it's become too recessed, too pushed back, we can augment the chin, which can be a separate procedure of chin augmentation, but often is combined, at least in my hands, I'll combine it by extending the chin back to where it was in youth. You can see it immediately stretches by stretching the chin back so that the chin projection is as youth, the jaw gets straightened. Then, if they're still remaining hanging in this particular area, we can actually directly insert the volume between this area, the hanging area, and the chin area to straighten the jawline even more. Furthermore, if we go backwards towards the angle of the jaw, below the ear, by volumizing this area in this way, in a triangular way, what happens is, notice, as this goes and stretches, everything along the jawline stretches. So in one fell swoop, depending upon the individual needs of the man or woman that we're treating, we can actually, and men and women have different anatomy, so that it has to be respected, and an experienced physician has to know where to put the material and how much, and what is for one gender and what is for the other gender. But by respecting these particular areas of facial fat loss and volume loss, not just in fat, but in muscle, in bone, in cartilage in certain areas, by respecting that loss and replacing that loss, what we get is we can achieve a straightening and a lifting that was originally the way things were when a person was actually younger. And again, they can get off the treatment table, and they can basically return to work or to social activities.